Because there's all these anti-vaxxers now, isn't it?
Well, Marina can tell you a little bit about how we've achieved.
It's clear what the Prime Minister makes of those against vaccines. Many might agree, but in the case for a COVID jab, public perception really matters. Leah says she wouldn't have a coronavirus vaccination. She's vaccinated her children and herself in the past, but she's worried about the speed of development this time.
What makes me nervous is that it's being pushed upon us and it's literally like a ransom for our freedom. That in and of itself is enough of a worry, because if the doctor said, right, okay, heart disease is just so horrific, it's our worst killer, you know, the government have decided we've now got to all take statins, I would say no. I'm not doing that. I refuse to take a medical intervention, any kind of medical treatment, that I haven't fully researched myself to decide whether I actually need to do it. That's the first and foremost thing. So why would you put something into your body without really knowing what's going to happen to you?
A new poll shows she's not alone. Just 53% of people said they'd be certain or very likely to get a vaccine against coronavirus, while 1 in 6 said they're unlikely or definitely won't. And some groups are more sceptical than others. 37% of people who believe face masks are bad for health said they'd refuse one. The under 35s were twice as likely as the over 55s to say they may not get one. Even within families who would all choose to vaccinate, the generational divide is a consideration.
I would take it. Might not want to take it in exactly the first wave of taking the vaccine, and but I can understand young people who are getting this disease, not having many symptoms. I can see they might be a bit more ambivalent.
The media has presented the virus as something that is less dangerous to younger people, so it gives an impression that, you know, you're more immune to it. But I can see why, but I'd also say it's quite naive.
Okay.
The weight of science and history says vaccines are safe. Trials here at Oxford University have showed positive early results.
There are currently no reasons to be concerned about the vaccinations that are being developed for COVID. They are undergoing intense scientific scrutiny, both the Oxford vaccination and the Imperial College vaccination.
The data shows there's significant crossover between those people who feel the government reacted too slowly to the pandemic and those who may be reluctant to get a vaccine. It could be our ticket out of the crisis, but it needs public cooperation, and that needs trust. Communication will be vital. People may well feel differently when a vaccination is approved and widely used, but the race is on not just to make it, but to persuade people to take it. Helen Ann Smith, Sky News.